This session is a MOU between INCAS Asia 2026 and the Association of Korean Dermatologists, AKD, and the Korea Derma. So welcome all of you and our well-known Korean dermatologic speakers and one Korean American, is it right? No, it's American dermatologist will present 4 topics. I will introduce the 2 doctors first, and then my co-chair is the president of the AKD. Now he will he will introduce another 2 doctors and discussion. So first speaker is Hae-Jin Lee. He will talk about revisiting hair loss therapy, my clinical experience with the latest skin boosters. Dr. Lee, please.
Thank you for introduction. Good morning. I'm Dr. Hae-Jin Lee from Yonsei MB Skin Clinic in Seoul. It is a great honor to speak here at IMCAS Asia. In this session, I'd like to share my clinical experience on AGA treatment, specifically focusing on how we can maximize treatment response rates using the latest skin boosters and biostimulators. As we all know, the pathophysiology of AGA is heavily driven by genetics and androgens. Conventionally, we have relied on 5-alpha reductase inhibitors and minoxidil to block DHT and stimulate blood flow. These remain our gold standard. However, in our daily clinics, we often encounter patients who show varying or sometimes disappointing clinical responses. This limitation naturally leads us to additional novel treatment to improve hair density. I believe the answer lies in the scalp environment. Imagine the scalp as a field. Under continuous DHT attack and the persistent microinflammation, the dermal ECM structure collapses. It becomes a barren, cracked land. Existing therapies often try to force a weak seed, the miniaturized hair, to grow in this desert. Instead, we need a multimodal rejuvenation process to treat the soil itself. By utilizing biostimulators, we can reconstruct the structural scaffold, control scalp tension, and provide a growth factor-rich niche. We are turning barren land back into fertile soil where the hair follicle can thrive. The one thing that you should be aware of is that many clinicians begin treatment without properly diagnosing AGA. In such cases, it is difficult to achieve a proper therapeutic response even if the treatment is initiated. Also, the patient above does not appear to be hair loss on the growth photo. There's a clear difference when comparing the hair on the occipital area of the head and the parietal area. In this instance, it can be diagnosed as AGA. In this case, the hair appears thin grossly, making it seem like AGA. However, since there's no significant difference in hair density between the back of the head and the parietal area, it is not AGA. If differences is properly identified during diagnosis, an appropriate response to treatment can be expected. This is not AGA. In classifying AGA, I usually use the BASB classifications. And also you can see that these guidelines, the most recent available, suggest treatment for AGA based on hair loss severity. As you can see, they were released in 2013. These guidelines haven't been updated for about 13 years. And the treatment options listed here are limited to oral finasteride and topical minoxidil and hair transplantation. The various treatment options I'll discuss today have proven somewhat effective, and I believe they could be added to the current guidelines for AJ in the future. Let's look at the PRP. The recent meta-analysis report showed that it is effective but not superior to minoxidil. However, this report analyzed the result without distinguishing between the difference in effectiveness depending on the PRP device. So I think more research is needed. However, wouldn't the treatment effective be better if we did all of this together? We can also inject Botox in AJ patients. Beyond just relaxing wrinkles, Botox relieves scalp muscle tension, increases local blood flow, and plays a crucial role in reducing microinflammation by modulating neurotransmitters and pro-inflammatory cytokines. It creates a relaxed, well-perfused environment for the follicles. Next is particulated human acellular dermal matrix. When injected into the dermis, it provides immediate structural support. It promotes fibroblast proliferation, enhances neocollagenesis, and significantly stabilizes the inflammatory microenvironment. It fundamentally repairs the damaged dermal layers. Similarly, highly purified autocollagen, or I usually use the Therafil, is for dermal rejuvenation. It deposits an immediate physical scaffold that drastically enhances the survival rate of dermapapillary cells. By restoring the dermal thickness and stimulating angiogenesis, autocollagen creates the optimal fertile physical environment for the anagen phase to be maintained. This video briefly demonstrates the AJ treatment performed at my clinic. First, we shampoo the hair. Then use a 1927 nanometer thulium laser. And followed by scalp mesotherapy. Although not shown in this video, PRP autocollagen or particulated human ADM may be injected during the process if necessary. Afterward, Botox treatments are injected at monthly intervals, and I primarily use the QoJet device for injections. And you can use, this is a vibrator, and the cooler decrease the pain. And finally, an 830 nanometer LED treatment is performed to complete the treatment. By combining the various methods mentioned above, improvement in such lesion can be observed. Even in the case of male in his 20s, improvement was shown after 3 months of treatment. And a man in 60s also achieved significant results. In the case of women in 50s, the above results were obtained through consistent treatment with PRP, Botox, and mesotherapy. Women in their 60s also showed similar results. The younger the age, the more significant therapeutic effect could be achieved with the monotherapy alone. And PRP and mesotherapy, which are proven methods to date, naturally showed significant results. Although the treatment response appears to be somewhat lower with increasing age, quite satisfactory results were obtained in case of consistent treatment for more than 6 months or more than 1 year. Although I didn't cover it in detail today, you can also expect quite good results from the Regeneron Activa regimen. And hair loss treatment using the particulated human ADM is also showing significant results with 3 months of treatment, and the number of cases steadily increasing. Theoretically, AGA treatment using particulated human ADM appears to be more effective, but in my experience, treatment using atelocollagen seems to be more effective. However, since this judgment is based on the results of only about less than 20 cases so far, I believe further research is necessary. The advantage of this treatment is it can be regardless of gender. However, unlike hair transplantation, it does involve the inconvenience of having to visit the clinic frequently, either weekly or monthly, for at least 3 months. Nevertheless, depending on the clinical presentation and the patient availability to visit the clinic often, combining various treatments can yield very satisfactory results. Although we are still unraveling the exact mechanism triggered by these biostimulators, the clinical improvements we see with various biostimulators like atelocollagen and particulated human ADM are too significant to ignore. By focusing on the Nikkei environment, we can offer our patient a far more robust and sustainable recovery. Thank you very much for your time and attention today. If you are interested in more, I invite you to visit my YouTube channel or connect with me via email or Instagram. Enjoy the rest of the conference, and we are looking forward to your active participation in Korea Dharma 2026. Thank you so much.
Thank you, Dr. Lee. Did you enjoy the Gangnam style hair treatment? But all doctors are not from Gangnam. I'm from Busan, and Jane from New York. So Dr. Gu from Seoul Station. So next speaker is Bonchil Leo Ku. His topic is what is the K-glossy skin and how we make it. Please, Dr. Gu.
Thank you. I am from the very center of Seoul, so thank you for coming, and thank you for having me be here. Oh no, it's okay. You can write down, turn the light a little bit. Okay. Okay. Today my topic is a little bit different with my previous lectures, speeches that I give. But this kind of topic will be very intriguing because I think historically this type of the mega trend that what kind of a Korean blah blah and Korean something is so popular, and interestingly the quality of the skin is quite a huge issues for why the Korean people they are so obsessed to get this kind of skin, and which is very, very popular for the global kind of the interest. So I will speak about the glossy skin. What is a glossy skin to be accepted, and how we can make it practically. Okay, so this is from the memorandum in between the IMCAS and the Korea Dharma for this session. And we hope to have you all in the Korea Dharma 2026 with many of the interesting topics and the crazy things happening in the annual event. So we see that this kind of glossy skin, as we see that there is a context, we see the flawlessness and the smoothness that is shining and glossy like glass, all covered with a coated in a top coat for the many kind of painted things. But if you see much more scientifically, so optically is a kind of a mixture with a radiance and a reflectance and the evenness. I think the radiance is coming from the deep inside with the scattered light from the skin, and the reflectance usually is from the epidermis with the stratum corneum status. Evenness is much more about the broad and the gross kind of images that we can see that this is an even and very homogeneous kind of a reflectance from it. So if you think about this as a cosmetic, do you do the cosmetic by yourself, or especially for men, it's quite strange things. But if you think about all the cosmetic product from the deep inside to the superficial layers, we see many layering kind of coverage from the primer, concealer base, highlighter, and the fixers. So if you going back in a reverse way, which is representing our texture from the deep side with the papillary dermis to the basement membrane and the epidermal structures and the stratum corneum. So it's a mimicking very, very natural baby-like a flawless skin into the one single makeup status. So if you just compare each one by each, it will be very interesting. How about the primer? Primer is filling the gap in the grooves and the furrows of the skin. So which is, if we don't need any primer from our nature, we need very, very healthy papillary structure, dermal papillary structures, because it significantly decreases with the age, with the height and its composition. And this kind of flattening, usually it is not maintained as a flattened one. It is folded and it is making the furrows in the irreversible way. So how we can make the reversible way is a very important task for us as we practitioners. So if you think about this kind of primer, like a treatment, is a papillary dermal rejuvenation, is alpha and omega. And from my experiences with using almost all kinds of the EBD devices, there is one solution and more solutions from it. I think they are finding is evidences with a much more scientific kind of basis. One is a microblade, microneedle radio frequency, precisely targeting the papillary dermis, and the hyperbaric jet injection, which is very popular nowadays, and the monopolar radio frequency, and quadrilumpers quite long ago, or legacy treatment called the Genesis. So these four types of the treatment has been discussed and have some consensus, or even at least some of the scientific kind of references from our good researchers to support these ones are making the papillary dermal rejuvenation. One example of the dual length microblader, the radio frequency, you see that what I see is if you see that the highlight of the one convex lesions, the top of the highlight or the apex of the highlight is moving according to your treatment. So which is making your skin much more reflectant, or make even your skin, the facial shape is even more kind of dynamic. And this is one example with there is no single right standard answer, but you can just make your own recipes to go on to this. This one is giving this kind of dual length microblade radio frequency and giving the polynucleotide inside, which is very useful to get the evenness and the homogeneousness, and for this shiny, glossy, healthier looking skin, much more importantly. And another kind of radiation treatment in aesthetic medicine is a concealer-like treatment, which is very easily interpreted with any of the spot remover and the lightening treatment. This one is usually if you remove the spot, one spot by one spot, but if it is graduated with just like a haziness, it is not looking as overgrowthness. Look at this guy, which is very old, and you can see that this just a spot remover makes your skin more reflectant. Why? Because it even much more homogeneous in height and the texture. So the skin glossiness is not coming from any kind of a real grinding and the blading on the top of it, but also from this homogeneity. Another thing is a base-like treatment, which is very important for the epidermal thickness and the papillary dermal thickness in the health condition. It is usually common in the biostimulators. Many good biostimulators are very popular among you, and we have more in the transplant. This one is giving the double tide and injector the frequency with a dual length microblade with a human-derived acellular thermal matrix, which is making your skin thicker and much more healthier, and is more resistant to the friction forces that is making your skin much more coarse. So it is very good for your skin to make radiant, okay? It can be done with many other skin biostimulators, but not in the DIA, especially in the popular dermis. So what I mentioned about the hyperbaric jet injectors and the much more precise injectors is much more popular because of this. Oh, yeah. So another thing is the highlighter like treatment. It is fillers or other implants that we can make the highlight on that. If you see that, what do you think this lady got? Because she got just anteromedial cheek augmentation with a very typical cheap hyaluronic acid filler only, but you can see the apex of your skin glossiness is moved into the very beautiful position. So it is very important to make your skin and the skin shape, the contour, facial contour is much more important to get the glossiness in a much more beautiful way. To go over to the reflectance, but firstly, moisturization for us is much more important than anything because if you think about the Korean type of the style of the makeup, you will see that many of the YouTube or the video clips with the crazy many, the basic, the top coat with the layering the multiple moisturization and the essence, serums, whatever. But I think that this kind of layering in the basic makeup is much more like an artificial coating of the top coat. We are going to glossy skin, but the moisturization will give you most of the reflectances, but its weakness is its maintenance because it's not lasting a day. So how we can make this kind of fixture like a treatment, we can see that the peels with a much more smoother, even kind of condition, or with the laser coagulative peels, you will see it's a kind of a legacy treatment with using the very low the influence with the Orbim-Yak treatment or the long pulse treatment or topical skin boosters. Nowadays is much more useful to that. This one is the 1929 the 40 the Orbim-Yak laser resurfacing, which is very legacy and very traditional kind of things. But you can see the reflectance of the skin is getting changed. Also with this, with the laser, this is thulium laser, and the resurfacing with the assist delivery with the polyhydroxy acid is making your skin much more smoother, evener, and they're much more reflectant. I will show just the before and after picture. You can just focus on how the glossiness is moving and they focused on it. Another one. And even with this microneedling radio frequency, just application of the topical polycaprolactam biostimulator is giving you the very homogeneous and very beautiful, the even kind of glossiness for this. So any treatment can not compensate or replace the makeup, but at least our patients want to have a much more healthier, bare naked skin, like just like what you did with the basic makeup. So thank you for your attention, and there will be more interesting thing in the Korea Derma 2026. Thank you.
Thank you, Dr. Gu. I toss the mic to my co-chair, Dr. Lee.
Hi, the next speaker is Shin Ji-yoon. Her topic is periorbital rejuvenation, EBD meets injectable. Dr. Shin? She is from the Gangnam in Seoul. She is a scientific director of the Association of Korea Dermatologists and Korea Derma 2026. If you are interested in Korea Derma 2026, ask her. Ready?
Yeah, everyone can see my face, right? Hello, everyone. Good afternoon. I'm Dr. Shin from Seoul, Korea. And in this session, I would like to talk about combination treatment for perioral rejuvenation. So before we start, I would like to introduce my dear patient. She has cutis laxa. So as you already know, cutis laxa is occurred by unknown electrolysis. So these patients have characteristic skin symptoms like laxity and skin sagging. So the gold standard treatment of cutis laxa is facelift surgery. However, with combination treatment, we can now achieve significant improvements without surgery for our patients. So the perioral area is one of the most dynamic regions because it moves constantly because of our facial expressions and eating. So wrinkles develop easily and signs of aging appear earlier than in other facial regions. So as aging progresses, we commonly observe collagen and volume loss and descent of fat tissue and smooth layers. So when we look at the jawline of a younger patient, they have very sharp and marked jawlines from chin to mandibular angles. However, with aging, the jaw formations becomes more apparent and prejor sulcus deepens and marietal lines become more prominent. These changes are caused by jaw fat descent of both mandibular ligament and volume loss of prejor sulcus. So marionette line is getting more prominent. And also we should pay attention to the lateral lower lip compartment. Volume loss in this compartment increases the contrast between jaw and this area, so contributing lip corner drooping. So you can take picture of this. So therefore, successful jawline contouring requires layer-based treatment approaches. First, at the fat layer, we can reduce excess fat using energy-based devices, for example, a microwave or lipolytic injections. Second, at the smooth layer, we can approve tightening, such as HIFU. And third, excessive downward pull from the muscles can be improved by toxin treatment, particularly depressor angular oris or platysmus. However, aging is not limited to sagging or jaw fat. Volume loss and wrinkle formation are also major contributors to perioral aging process. So volume depletion commonly occurs in nasolabial fold, lower lip fat compartment, and prejor sulcus, lip, and smoke lines. So we should restore these. So the lip themselves also age over time. So we often observe thinning of the lip and perioral rhytides. Fortunately, HA fillers can effectively improve these concerns by restoring structure support and enhancing tissue expansion. In addition, through lip filler, we can create a more useful and brightened smile. When we restore volume, not only the lip, but also in the chin and nasolabial fold, we can achieve a more harmonious lower face contour. So for the chin and nasolabial fold, high cohesiveness HA fillers are often preferred. To perform filler treatment safely, it is essential to understand facial anatomy. So one of the most important things is avoiding major arteries during procedure. The facial artery crosses the mandibular boulders and ascending toward the nasolabial fold. It gives rise to superior and inferior labial arteries, continuing as the angular artery. A cannula was introduced lateral to the oral commissure and injected in the subdermal layer. So understanding safe injection planes and entry points is important. So through the paper, G prime 250 Pascal fillers in subdermal layer are ideal for perioral rejuvenation. So after HA filler treatment, we can observe improvement during dynamic facial expressions too. We can choose another insertion point to improve other compartments, such as pressure sulcus. Today, there are many biostimulators available in the market. These treatments can stimulate collagen production and improve skin qualities over time. Several studies have already demonstrated the benefits combining HA fillers and biostimulators for facial rejuvenation and perioral too. Now, let's return to my patients before. So these are my combination strategies for my patient. For her lower face and neck, I selected HIFU to improve tightening. And second, I used biostimulators to restore volume and perioral rejuvenation. Third, I performed lip HA filler. Over the following 2 years, from 2024 to 2026, her results remained stable and natural. So this case demonstrates the value of a personalized combination approaches. So you can see, you can experience several cases through this combination treatment, EBDs and injectables. So I combined monopolar RF and HA fillers in this case, and I combined HIFU 1.5 millimeter tips with fillers and biostimulators in case. To summarize, the perioral area is highly prone to aging because of constant movement. Perioral area involves multiple layers, including skin, fat, mass, and muscles. Therefore, no single treatment can address every aspect of perioral aging. So here's summary. And the key is to identify the primary aging mechanism. So select an appropriate treatment for target area is highly important. So personalized and layer-based combination treatment provides the most natural and effective outcomes to our patients. Thank you very much for your attention, and here is my Instagram code, and I hope to share our insights again. Thank you.
Thank you for your excellent lecture. The next speaker is Jane Yu from USA, not Korea. Her topic is K-beauty myths and evidence, a dermatologist clinical review. Ready? Yeah.
So thank you so much for being here today. So I'm going to be talking about K-beauty through a dermatologist lens. So today we're doing what the internet will not do. Put K-beauty through an evidence filter. Not dismissal, but honest appraisal. So we'll go over what K-beauty generally gets right, what is overhyped, and 3 emerging bioactives, and then looking into the EBDs in the Korean derm world. So this is a huge market. K-beauty is not a trend, it is a market. Globally, around $14.7 to $16 billion estimated, and then projected CAGR anywhere from 6 to 8% by 2034. So this is a huge, huge market. And a lot of you know this because I can go to any place from France to Amsterdam to South Africa to Central America and find K-beauty products and supplies there. So in the United States, as dermatologists, we cannot dismiss K-beauty because our patients are using it, our patients are asking for it, and the question really comes to this: whether the formulations that our patients reach for are doing what the marketing claims, and whether we as clinicians can rise above the noise and educate the public. So this is a quick roadmap of what we'll be covering today. We'll spend on what it gets right, what it gets wrong, looking at PDRN as well as exosomes, energy devices, and then some clinical pearls. All right. So barrier-centric formulation. This is K-Beauty's strongest scientific contribution. It has an emphasis on ceramide-rich, pH-balanced, low irritant formulations, and this aligns with what we prescribe as dermatologists, especially for compromised skin barriers. So if you look at the 3-1-1 golden ratio, you're looking at ceramides, cholesterols, and free fatty acids, and this is the exact ratio that we need. In a lot of the cleansers, the pH stays at and preserves the acid mantle from 4.5 to 5.5, and we use a lot of humectants to draw on the water, such as hyaluronic acid. This is probably K-Beauty's greatest gift to dermatology. The FDA finally approved bismuthrizonal this month, actually in 2026, and this is something that we have been advocating for the past 20 years. And the K-Beauty market has been driven by this photostability innovation that has been benefiting patients from all over the world, and you hear about people going to Korea to get the next generation of UV skin filters. This includes Tinosorb S as well as M, and other things that provide superior UVA coverage. Why does the UVA matter? It does because in patients that have melasma or hyperpigmentation, you want to make sure that you protect against visible light. So again, these formulations are better able to protect our patients, and that's a total win. Now, looking at the different actives, there's several that have randomized controlled treatment level support. So the first is niacinamide. Niacinamide is obviously the star. 4 to 5% niacinamide has head-to-head data against hydroquinone with a better safety profile. And so this is something you want to take to your patients, and this is something that's clinically actionable. Sika, or Centella asiatica, has enough wound healing data to be useful post-procedure. So again, a lot of these things that are coming out of South Korea are actives that we do want to utilize in our daily practices. Green tea, as well as snail secretion, have lower amounts of evidence, but again, you want to look at all of the things that are available to you in the clinical data. Now, I'm just going to go into part 2 about what K-Beauty gets wrong. So this is the 10-step routine where you recommend oil cleanser, foam cleanser, okay, exfoliant, toner, essence, ampule, serum, sheet mask, eye cream, and then moisturizing and SPF. So I guess maybe 11 steps. How many people do 11 steps every morning or at nighttime? Tell me, okay? Rituals are really valuable for adherence and self-behavior, but it's not realistic on a day-to-day basis. So we need to redirect our patients to develop from having some sensitization and from them to spend hundreds of dollars on redundant products. And so I always tell my patients 3 to 4 steps is probably going to be your maximum. You need a good cleanser, an active, a moisturizer, as well as an SPF. And that's really all you need at the end of the day. Laser too. So what is it about these actives? Because a lot of people think the more that you put on your face, the better. It's actually not true. So if you look at this chart, you can see how different things will interact with other actives. So you never want to be using a retinoid as well as an AHA or a BHA together with one another. And you know that one ingredient here, stays for all of the, checks all the boxes, and that's niacinamide. So that's a really, really star product. I know Banchal Lee Go talked about this. What exactly is glass skin? I have seen multiple patients with truncal acne as well as perioral dermatitis caused by some of the glass skin routines that they're trying to achieve. So the porelessness ideal is particularly damaging because pores don't respond to layering and they respond to other actives such as retinoids. So you really want to counsel your patients about trying different ways to achieve this glass skin because again, is it an aesthetic goal or are there some clinical outcomes that you're trying to achieve? So now moving on to part 3, PDRN and polynucleotide revolution. Okay. So this is something that's really new and interesting, and I think a lot of people have been asking about polynucleotides. They're from salmon sperm DNA, which is the backbone of the Korean skin booster ecosystem. So they have different mechanisms of action, including this adenosine receptor, and then the nucleotide Savas pathway as substrates for fibroblasts and a regulation of VEGF. So the A2A mechanism is a legitimate pharmacology, and the wound healing is generally solid. And this is used off-label for post-laser purposes. And I think this is the most defensible emerging stuff for injectables. The problem is that sometimes you have these wound healing data to justify the rejuvenation claims, and they haven't been properly tested in powered blinded clinical trials. Topical PDRN evidence here is weak. So you want to understand that in the skin barrier, there's a 500 Dalton rule. So in order for things to penetrate into the skin, it has to be less than that amount. And so often the molecule is much bigger and so cannot penetrate to where it needs to go. So again, you want to counsel your patients and note that if the molecule is too large to be delivered, it can't do its job. So what is the clinical verdict here? I think, the injection protocols have enough biologic rationale, especially post-laser. The topical products are benefiting from this halo, effect, but they don't necessarily deliver the active molecule unless you're doing something like a microneedling treatment or like an Erbium YAG treatment where you're actually penetrating into the skin. So always ask your patient about the delivery mechanism of the product and whether the absorption data exists. Spicules. This is the new kid on the block. This is something that people say is akin to microneedling. And this is a case where the absence of evidence is evidence. So I did a comprehensive PubMed search for spicule cosmetic treatments and found 0 indexed clinical trials. So there's really none here. And this spicule facial marketing market is run entirely on marketing, influencer content, and extrapolation from microneedling biology. There is a plausible mechanism, right, because these are from microscopic silica from freshwater sponges, but then again, the same logic applies to sandpaper, right? So the mechanism alone does not justify the product. And more seriously, I think they're being utilized in medical spas. And, of course, you want to make sure that your patients know where they're getting their sources. And the bottom line is this. The idea makes sense. We're creating tiny little injuries to trigger collagen, but it's not the same as microneedling in your office. Okay, part 4, exosomes. The new frontier or the new hype? Here, exosomes have been hyped up, and then now there's been kind of this decrease, and now we're on this plateau. So what they are just basically nano-sized extracellular vesicles, and virtually all cells kind of have them, and they have different pieces of cargo, including mRNA, proteins, lipids, and that sort. And they act as communication between cells. So you can think of it as an envelope that holds a letter and goes from one place to another. I think that we have a lot of data in certain areas, including wound healing as well as hair loss, and the science is legitimate and exciting, but the commercialization is running 10 years ahead of any sort of standardization. So currently for exosomes, there is nothing worldwide in terms of standardization of characterization as well as any isolation methods. So this is just something you want to take note of. And then this was a systemic review of looking at all of the clinical appraisal of the exosomes to date from 2026. And there are only 8 studies and on microneedling and exosomes that meet the quality criteria. Okay, part 5, energy-based devices. HIFU, micro HIFU, radio frequency and combination platforms. This is where things get exciting because I think this is where we have most of the science. And the Korean market often runs 2 to 5 years ahead of what's published in the index literature. HIFU is the most evidence-supported device for non-invasive lifting. Combination protocols are being pitched heavily, and we just want to make sure that we treat everything with skepticism until randomized controlled data arrives. Post-procedurally, there's a permeability window, and it's open to the skin, but we want to make sure that the products that we do place post-procedurally are from sterile vials. Okay. Again, the K-beauty device market presents a patient safety problem for skin of color populations. So this is something that is a critical gap here because most of the K-beauty devices are conducted in East Asian Fitzpatrick 3 to 4 skin types. So we really need to have more data generated for Fitzpatrick's 4 through 6. So what are the clinical takeaways here? I think K-beauty has made a genuine contributions to photoprotection, barrier science, cosmetic elegance. I think in terms of what its flaws include, marketing, overextension into unvalidated territory. Your job is to be the translation between Korean innovation and evidence-based practice. So keep what works, keep what doesn't, and stay skeptical of anything that bypasses the scientific evidence. These are my references. And then if you want to connect with me, please do. Thank you so much.
Yes, thank you. Nice lecture. Yeah. Is there any question on the floor? Question or comment? The first question is for Dr. Hae-Jin Lee. Yeah, on the floor. What depths do you inject for hair mesotherapy manually and with the injector gun? What depths?
Actually, that very shallow, and I recommend the interfollicular injection, maybe 2 or 3 millimeters depth.
How about inject gun? Do you use inject gun?
Yeah, we also I also use the injector like CureJet.
Yeah.
So that is very superficial injection.
Yeah. Any other question or comment? 뭐 다른 질문? 하면 예. 그다음에 들어오세요.
Okay, Jane, how did you know the K-beauty better than me? I think 4 more years ago, we talked about exosome.
Yes.
Exosome is prohibited in Korea for injection.
Yeah, and it's,
Only-
it's
only
prohibited
topical.
in the United States for
It's
injection
same,
too.
right?
And also, did not know this, but PN as well as PDRN is prohibited for injection in the United States as well as Taiwan. I didn't know that. So again, follow your country's guidelines. I think some of the evidence that I presented are from injectables. So again, you be careful of comparing the injectables versus the topical treatments.
Today you did not mention about human acellular dermal matrix.
I did not.
Yeah, that is a very popular in Korea now.
Yeah.
So Bonchar, would you comment about that kind of thing about a glass skin with
Where
ADM?
Okay. Where human acellular dermal matrix is definitely a new one that we didn't get any chances to use because this is just the first the type of the injectable transplant, and I think it has a very huge potential. And recently, the Korean FDA, MFDS, they allow to use the human adipose cell tissues from the garbage into the one renewable. So I think this kind of a category will enlarge the opportunity for the newer type of the regeneration. So I think I have a huge kind of expectation for that.
And
Hae-Jin Lee, there is another question. Is manual direct injection better compared to microneedling for hair loss? What are your thoughts on the exosomes for hair loss treatment?
In my experience, I also use the exosome treatment, but exosome is not bad, but I think not better than PRP or Botox injection.
Yeah. Dr. Shin, there are many products or PNP, PDRN. What is your thought about the product? It is very popular in Korea. Many patients like that material. How about you?
Thank you for comment, Dr. Lee. PN and PDRN is approved for injections in Korea, so we can inject into the skin. So most Koreans love PN, PDRN because it also hydrates skin and also enhance the skin quality and skin ability. So it is widely used not only for skin boosters, but also combined with acne or sensitive skin treatment. So if you are interested in that treatment, I hope you try it, or as a patient in Korea, so in this December.
do you use? I watched your slide. You use the Korean filler, Korean company fillers,
Yes,
right?
doctor. Yes.
L'Oreal fillers.
Oh, yes, that is correct.
Would you compare to the Allergan and Galderma fillers with the L'Oreal?
Oh, that's also very good comments, because in my clinic we have total 4 company fillers, Restylane, Galderma, and Juvederm, Allergan, and Belluterra and Merz. And first one is L'Oreal filler, it's Korean product. That product has similar skin osmolarity, so it has a low swelling right after the procedures. So it is very easy to predict the result. So, and also that has 3 lines named number 2, number 4, number 6. It has different cohesiveness, so it is very easy to choose, depends on the patient's skin type and the reason. So if you want to try that filler to December again, I hope you try that material. That filler is very good.
Is there any question on the floor? Hae-Jin Lee, I have one more question. Yeah. Doctor, you mentioned about the spicule. We called it Aladdin pill. Yeah. How about your thought about Aladdin pill? Spicule product.
Aladdin pills?
Aladdin pill. The spicule product.
Speaker product.
Do you have any experience about spicule?
Sorry, but I don't have any.
Experience. Dr. Gu, do you have any experience about the spicule product? Yeah, Aladdin.
Aladdin.
Yeah. You mentioned about that product. It is very popular in Korea, and many doctors use that product on the clinic. And some cosmetic company make a similar product.
The commercial name is Riddle Shot, and the speakers, which is like a microdermabrasion, but it is a little bit different because it is the impingement into the skin, stratum corneum, and it is making the exfoliation from that in a very delayed way. Actually, I don't. There is not my favorite because it has a very narrower kind of a safety range, especially to the very sensitive skin patients. So I don't like it personally, but it is very, very popular. And now they have a variety of the ranges from the very short kind of speakers to the very large satellite type of the speakers. So we'll see. I think that it's not anymore the professional product. It's much more like a commercial product. So maybe we can just see that what kind of things happening in the market. I think it's a practitioner's job.
Okay, one more question. So, would you tell us the recent trend of the EBD in Korea?
Or the current trend in EBD?
Yeah,
in
Korea
short term?
trend.
Okay. I think the trend for the newer sources of the EBD is now rising, like a shock wave, different type of the shock wave, artificial chromophore induced shock wave like Beluti, or other kind of.
It's a secret.
Yeah. Okay. And there's sources like the pulsed electromagnetic field is also kind of the approaches that sees the potentials in the market, but it's very there is birth stages, so we will see that, but not very kind of younger. In the short term, it is kind of younger.
Dr. Shin, would you tell us the current trend of injectables or ECM
Skin
enhancers,
boosters.
right?
Okay, before I close these sessions, I would like to introduce new skin boosters to you. Dr. Gu already mentioned an acellular dermal matrix. That material is extracted from human real skin, so it also deliver skin booster effect, but also okay, so that is very interesting. Skin boosters, for example, we can apply that human acellular dermal matrix to burn patients. As you know, burn patients lose their skin, right? So in that case, we need transplant acellular dermal matrix. The patients, their skin loss, then they can recover much more faster. So, but you know that PN, PLA, PCL, they are all great biostimulators, but they do not use to burn patients, because if you want to get biostimulated effect by using that product, you still need skin, right? Because they are basically need the help of the skin. But by using acellular dermal matrix named Rituo, Jubacell, Celdium, so you can use every patient, even the patients without skin, because it have very regenerative effect itself.
Just one last comment is, if you think the aging process of the skin is also kind of a slowly progressing deficiency of the dermal matrix components, the transplantation of the replacement with this component is nothing new, but very fundamental. If the skin has lost its efficiency or the potential to make a regeneration from its nature with a very thin fibroblast and other kind of a cellular composition inside, there is nothing to induce them to make one thing. So, like a sarcopenia or the muscle loosening is losing the muscle is now regarded as some kind of aging processes. Is all the same. When you don't get the exercise effectiveness very well, the one thing is getting the replacement from outside.
Thank you, Dr. Gu and Shin. Is there any other question or comment in the floor? Is there any question about infantile hemangioma and porcine stain? I'm a specialist. I can answer. Okay, time is up. Our session will be closed. If you have any interest about K-Beauty and a question, please visit Korea Derma in December, Seoul. We will welcome all of you. Thank you so much.
See you in Seoul.